my name is Novia Wong. In the study Mental Wellbeing at Work, Perspective of Software Engineers, we interview software engineers from different companies in the United States and explore the current state of software engineers' mental well-being at work, as well as the challenges and potential technologies that can aid with managing mental well-being at work. I will now highlight some of this study details. In the United States of America in 2021, 52% of surveyed workers experienced burnout and 76% reported overall poor mental well-being at work, which was an increase from prior years. This can further exacerbate the impact of poor mental well-being. For example, employee productivity and job performance are affected, organizations face problems with job retention, and workers can even experience physical health symptoms. To further understand mental well-being at work, the Job Demand-Control-SUPPORT, or the JDCS model, can be helpful. Through this model, we can understand mental well-being at work by categorizing different jobs and employees into different categories, which help indicate the risk of psychological strain at work. Based on a low to high spectrum of the three components of the model that are demand, control, and support, different job profiles have been created by past studies, including low strain, active, passive, and high strain. Particularly, a high strain job profile such as healthcare typically indicates that there's an increased likelihood to experience poor mental well-being at work. Other factors such as interpersonal conflicts with coworkers, individual differences, social cultural factors, interruptions, and working overtime can also affect workers' mental well-being. Looking at past studies and recent news articles, we identify some current solutions in which organizations and individuals have attempted to address mental well-being and facilitate its management at work. These include, but not limited to, increased paid time offs, financial support, employee assistance programs, flexible work schedules, and wearables for stress sensing using heart rate monitors. Workers have also used mental well-being mobile applications to manage their mental well-being, and some organizations have offered stipend and financial support specifically for wellness-related technology purchases. However, despite the efforts by organizations, employees continue to feel that these solutions are insufficient and often not useful. Because of that, we need to explore the lived experience of employees to better understand the barriers they currently face and the strategies they currently use to manage their mental well-being at work. Specifically, among different professions, software engineering is one that frequently experiences high job demands and burnout. Last year, the Great Resignation occurred because of that. Additionally, software engineers are reported to have a high suicide rate compared to other professions. Because of their tool-intensive nature and constant changes in their work requirements, they can also be considered as a high-strain job in the JDCS model. This study, therefore, asked three main research questions. 1. How does mental well-being manifest itself at work for software engineers? 2. What challenges and barriers do software engineers face with current technologies and company policies for mental well-being? 3. What do software engineers expect from technology for managing mental well-being? We recruited participants through professional networks and snowball sampling that asked participants to refer others who might be interested. We then conducted 14 semi-structured interviews with participants from different companies with a range of work experience as software engineers. To analyze the study data, we used inductive open coding, where two researchers on the team coded all 14 interviews and then reviewed the results with the rest of the research team. It is important to note that the research team is interdisciplinary, consisting of experts from the software engineering field, human-computer interaction, and psychological science. For more details on participants and data analysis, please refer to our full paper. We will now highlight some of the study findings. First, we found that participants relied on a variety of strategies to manage their mental well-being at work. They balance work and personal time using to-do lists and micro breaks. One participant said that they would watch the clip here and sit down, maybe read some articles. Some participants prioritize work activities as a coping mechanism. feeling like they had no choice but to try and push through it. Others learned to avoid potential contributing factors to poor mental well-being, stating that if I know I go this route, I'll be stressed in a month, so I don't want to go this route. And participants found that coping with peers and managers through shared experiences during challenging time is a helpful strategy. When working remotely, one participant said that their team and they basically just vent to each other while playing Among Us, an online game. However, we identify some challenges to successful mental well-being management at work. Particularly, challenges with organizational policies included overall unawareness of mental well-being policies, unfamiliarity with their usage, and skepticism of the intention of such policies. One participant stated that their paranoia was that the company is paying for the hotline, and therefore, how do we know where the reporting is going to? Participants also experienced attitudinal challenges related to time commitment, cost, and efficacy of mental well-being solutions. One participant described their experience with mobile applications. I just kind of stopped doing it. Like you have so much time in the day, it's easy for stuff like it to get deprioritized when you're feeling good. Participants also described technology fatigue as a challenge to adopting digital mental well-being solutions. Specifically, software engineers frequently work with computers and technology. In the words of our participants, even though virtual social support can aid with mental well-being at work, when I need to relax, the last thing I want to do is pop on the camera and do yet another thing on my computer or my phone. Participants suggested potential technologies that they prefer to facilitate mental well-being management. These include automation and passive sensing, such as analyzing workers' tone of voice, and as suggested by our participant, using machine learning models that basically can predict if someone is depressed or even susceptible to suicidal thoughts by just analyzing their voice, as well as having their computers remind them to take breaks. Perhaps even block you from doing work, maybe at noon, like, it's okay, you're supposed to take a break. They also believe that we could leverage existing technology to manage mental well-being, something that one of the participants has already started to do by using Google Docs as a self-reflection and journaling tool. Through this study, we identified 3 key insights to addressing mental well-being at work. First, there is a need to identify specific factors beyond the job demands, control, and support factors as outlined in the JDCS model that lead to poor mental well-being, and when it becomes problematic in each specific high-string job profile. In the case of software engineers, the stress that comes with the job sometimes is seen as a challenge and does not necessarily lead to poor mental well-being. Second, mental well-being is a multi-level challenge that spans individuals, teams, and organizations. Interactions across factors from these levels further complicate the manifestation and management of mental well-being. Therefore, solutions and interventions should consider a multi-level approach. Third, there is a need to formally integrate mental well-being into work technologies. For example, software engineers frequently utilize technologies to facilitate parts of their agile process, including their daily stand-ups and retrospectives. These technologies can include mental well-being features that not only facilitate mental well-being education, but also team-based experience. It is important to acknowledge some ethical considerations around implementing mental well-being technologies at work. Our participants brought up skepticism as a reason for not leveraging existing solutions. Other studies on work productivity tools also suggest that it is important to consider data privacy regarding employees' mental well-being data and users' autonomy in determining the amount of information to provide and the use of their data. Finally, there are several limitations to this study, the 2 primary ones being the small sample size that we had and the participant experiences are limited to the United States of America work culture. I thank my co-authors and others who have helped provide feedback on this work and paper. Thank you so much for listening.